Hi there. We're going to continue with our first unit of abnormal psychology notes today, so let's get started. During the last section of notes, we looked at the medical model in regards to mental disorders, and today we're going to look at different types of behaviors and perhaps trying to make sure that we are not using bias when we are looking at behaviors of others. Sometimes when we look at somebody's behavior, I may see the behavior one way and you may see the behavior another way. And so the goal for researchers is to try to make these judgments without bias. So we have to kind of take a look at, behavior as what we are looking at in regards to it being both determined by the content and the context. Later on in the semester, we will take another look at the classification of mental disorders, especially a closer look at the DSM-4, which lists all of the mental disorders. And like I said, we'll take a look at that as we look at the treatment of mental disorders. First, we're going to look at a classification of disorders called anxiety disorders. So anxiety is a natural and common reaction to many of life's difficulties. We are all afraid of something. I am afraid of snakes. They move, they shouldn't. They don't have legs and they don't have shoulders. So if you think about something that causes you anxiety, I think we all have those feelings at some point in our life. But an anxiety disorder is a class of disorders that are marked by feelings of excessive apprehension and anxiety. I don't look like the picture when I see a snake, although I get out of the snake's way when I see one. We're going to break down the 5 principal types of anxiety disorders, also starting with generalized phobic disorders, panic disorders, OCD, and PTSD. First, I want to talk a little bit about generalized anxiety disorder. This is a chronic high level of anxiety that is not tied to any specific threat. People who suffer from this may worry constantly about yesterday's mistakes and tomorrow's problems, excessively so. They may dread decisions, and you will see that this anxiety is sometimes accompanied by physical symptoms such as trembling, muscle tension, dizziness, faintness, sweating, heart palpitations. Phobic disorders are persistent, irrational fears of an object or a situation that presents no realistic danger. I've listed a couple examples for you. Acrophobia, fear of heights, claustrophobia, fear of small enclosed spaces, and this is just something that I looked up because I was curious. Brontophobia is fear of storms. Panic disorder and agoraphobia. Panic disorder is characterized by reoccurring attacks of overwhelming anxiety that usually occur suddenly and unexpectedly, kind of out of nowhere. Additionally, agoraphobia is the fear of going out to public places, and sometimes people who suffer from this become prisoners, confined to their own homes because they don't want to leave to go out into the public. And now psychologists kind of look at this as perhaps a complication of panic disorder, and we will look at that a little bit more during the semester, how sometimes if you suffer from one, it could be directly related to another mental disorder. Did you see that TV program on OCD the other night? See it? I taped it and replayed it 367 times. Haha. My funny cartoon covered the bullet points also on the content for obsessive compulsive disorder, so you can look at the funny cartoon as I walk you through definitions and characteristics of OCD. Obsessions are thoughts that repeatedly intrude on one's conscious in a distressing way. Compulsions are the actions that one feels forced to carry out. So OCD is marked by persistent, uncontrollable intrusions of unwanted thoughts, obsessions, and urges to engage in senseless rituals, compulsions. Some common examples of OCD are repetitive cleaning, rechecking of locks, faucets, and such, excessive arranging, and hoarding. The last topic for this section is post-traumatic stress disorder, commonly called PTSD. We see more and more about this mental disorder, especially as our vets are returning home from conflict in the Middle East. But PTSD involves enduring psychological disturbance attributed to the experience of a major traumatic event. So, like I said earlier, this could be, coming home from war. It could also be a severe auto accident, a harrowing war experience, a natural disaster, a traumatic event. And symptoms could include experiencing traumatic events in the form of nightmares or flashbacks, emotional numbing, alienation, problems in social relations, anxiety, anger, and or guilt. So I posted an article for you to read. It's an article about PTSD in first responders, and I want you to make sure you read that. It's posted, in one of your assignment folders, so please make sure you read the entire article and respond to the discussion. And that's it for the content for this week. Next week we'll probably finish up the section, which means we'll be ready for a quiz. But I will get you through that next week. Other than that, if you have any questions about the assignments or the content or anything else, please make sure you message me so I know. And hope you have a nice week, and I'll talk to you soon.